back. So apologize for if you were cranking your neck, and that's funny enough because today we're talking about neck pain. Last week we talked a little bit about low back pain and some things connected with chiropractic. And just so you know, if you're watching this, we're not pulling out all the data and everything. That's for you to go. You have internet now these days. But we are talking about some things we've learned, we've heard, and some data that we're able to share with you.
Maybe we should reintroduce ourselves since this is another video in case someone wasn't on the first one.
So we weren't on the first one, we were sideways. Anyways, I'm Dr. Kyle Duryea with Simply Health Chiropractic.
And I'm Dr. Aaron Underwood with Simply Health Chiropractic.
Yeah, we're here in St. George, Utah, and we are doing these live events just to communicate a little bit about our experience with upper cervical chiropractic, meaning upper neck chiropractic, and some various things, diseases, processes, pains that we've seen come in the office, and how and our experience based on those. So today we want to discuss about neck pain.
Neck pain. A lot of people experience neck pain and have different reasons why they have neck pain. Looking at some of the most common causes of neck pain, the one that we look at a lot is misalignment, bone structure, sometimes skeletal muscle issues, but the big one is trauma.
Yeah.
Which can result in any of those two we first talked about.
And most of that trauma that we see a lot is anything from a multiple series of traumas. Maybe it was the 3,000th time you learned to walk. Maybe it was the one time you fell off your bike.
The one time.
Or the whatever time it is that you got in that motor vehicle accident. We've actually ended previously. We discussed about concussions,
right?
And how that does. If you're getting a concussion, you've already got neck trauma, because neck trauma can occur at such small variances and such small incidences,
right?
That even if you don't feel like you got injured, you probably injured something,
right,
in the neck.
Had a client in today after a car accident. They've been under care. They're like, I'm not noticing a lot of pain,
Right.
but still it was only a few days after the accident, and sometimes even it can take up to a week, 2 weeks before the pain of that incident really kicks in.
And we've had that before, where somebody had an accident a couple weeks before. They've come in they've had no pain for 10 days. They came in and now they're having pain, and we had to tell them it's okay. It was from the accident. It just took that long for your body to figure it out.
Right.
And that happens a lot actually in care or society, that somebody has pain, they can't figure it out. Even in my own case, I had a back injury, different than a neck, but it actually took years,
right,
for it to truly manifest itself.
Yeah. And so sometimes people will try to look back, oh, yesterday I did this, but it may not have been what you did yesterday.
Right.
It could have been 6 weeks, 1 week, or
10 years.
10 years.
Could have been 10 years ago.
Right. And so a lot of times we're playing catch up with the injury instead of taking care of it when it first happens.
Yeah, so neck pain is interesting because it can be described in a few different ways. It can be upper neck pain. Some people will describe the headache as neck pain. We got neck pain that, in the natural neck, even into the shoulder, sometimes people will describe as neck pain. And so we've had those types of variances with people describing their neck pain.
And sometimes people even get shoulder pain associated with that neck pain, and so how closely the shoulders can be related to neck pain.
And we'll get that. Well, we're saying we'll have shoulder pain that's actually relatable to the neck and everything else. And we've even had that discussion where we've talked about the low back is actually a neck problem many times.
Right.
So even if it's a shoulder problem, it can be a neck problem. But we're specifically talking about neck pain today.
Neck pain.
Yeah. So what are some things about neck pain that we've learned?
That a lot of times it's treatable.
Yeah.
Sometimes it's not that instant fix, but even we just saw, looking at some things on WebMD, saying 90% of neck injuries over time, if treated conservatively, can resolve over time.
I think it even said that even if it's a disc bulge, it can resolve naturally and normally all on its own many times. So we get, many times I think we get a little distraught that, oh, this neck pain's lasting a while.
Right.
And it's actually a normal process for the body to have pain while it's healing in many cases.
And man, I had a lot of clients with neck pain today. One that has been under care for a few weeks now. She's improvement from when she first came in, but she's like, yeah, I still having pain. I'm like, well, we're healing some torn muscles that need some time to heal, and unfortunately that's going to be more time, but we are better than when you first came in.
I think that's one thing to know too, Dr. Aaron, is that muscles and tendons take time to heal.
Right.
And the healing process can vary from person to person, but you know, the average muscle heals within 6 to 8 weeks. Right? If it's the actual muscle belly of the tissue. But you take a tendon, and there are tendons in the body that can take up to 6 to 8 months to heal properly.
Right.
And yet we're like not feeling that. We get past the pain point of the healing process, and we're out there running down and stuff like that, and we're you know, keeping re-injuring things.
Right. And sometimes you make those corrections like, man, I feel so much better. I'm gonna, I don't know, climb a mountain.
Right.
Or do something they haven't done in a while.
Scuba dive or something.
They give us a call, be like, I don't know what you did, but you screwed me up. And they come in, I'm like, okay, what do we do? And they're like, well, after I got done,
I went and did this. And
I did this.
I didn't do anything but rake my yard for 5 hours.
And we're like, well, there we go.
I didn't do anything but go to a rock concert and
was headbanging for...
go crazy over there. Yeah. So a lot of times that's true, right? We don't think about that it was what event, you know, re-injured or how, you know, whatever it was that re-exacerbated that injury.
But sometimes, you know, you make that neck adjustment and the body starts healing. Mm-hmm. And again, we can have pain after even the treatment process.
You know, one thing we talk about neck pain, and a lot of people, of course, get concerned, especially when it's lasting a while. A lot of people turn to the surgery route. Right. And that can be a little dangerous on its own.
It can be.
So some of the things about surgery, neck surgery, are the actual pain of neck surgery resolving is actually, they say is very successful. The actual outcome of neck surgery tends to be not very successful.
Well, we went in there to fuse your neck, and we did a great job at fusing those bones in your neck. Yes.
So the surgery, a lot of times, very successful, but the aftermath tends to not be very successful. If I remember right, the statistic on the outcomes after neck surgery is pretty low.
Right.
And it's pretty near. And I'm just gonna throw it out there. This is the statistic of Dr. Kyle, but it's like, if I remember right, it's near 100% of neck surgeries outcomes are not positive.
And a lot of times when they go and fuse those joints together, what does the joint above and the joint below need to do? They need to compensate for that lack of mobility. And a lot of people who have that one neck surgery go in, and what do? They either fuse the joints above or the joints below.
There's some interesting side effects. Well, no, I shouldn't say side effects. I guess there's side effects, but there's some risks involved even with surgery. We're not saying that surgery isn't a solution.
Right.
We're just saying that there are risks to surgery, and in this case, neck surgery, those risks are pretty interesting. Obviously, infections as an obvious thing. You know, you're getting in there. It's not that they're using sanitary equipment or anything. Maybe they are. I hope they are. But you know, afterwards, there's a possibility of infection getting into the wound, the insertion point. Even getting now, because the cut is all the way to the bone and very close to the spinal cord, there's a risk of even infection into the meninges, and into the spinal cord itself.
Right. Also, excessive bleeding, which is always can happen. Not closing up something completely, or even, you know, start moving a little too soon before things have chances to heal.
Well, one of my favorites is chronic neck pain is a risk of neck surgery.
Right. So we're going to go in here and fix the problem that you have, and you're probably still going to have pain afterwards.
It's like one of those Muppet moments, you know, like the Muppets, they don't have that neck. Really? Yeah. Well, it's true. So chronic neck pain is a risk for neck surgery. There is a risk. It's a risk that's not. The surgery itself may be very successful, right, and that they did the surgery correct. But the chronic neck pain is now a problem, and we have a couple clients who have had neck surgery who have chronic neck pain, and they will
Probably have the rest of their life.
we don't know. It has been reduced,
Right.
but it is not gone, and our hope is that it will continue to reduce.
Right.
But there are many who do have it completely gone. We just cannot say, oh yeah, we're gonna make these adjustments because it's fused.
Right.
We can't. You cannot adjust a fused segment. Well, I mean, I guess with a sledgehammer maybe, but you don't want to do that. We don't do that. We don't want to do that.
And if you do make an adjustment after it's healed in time, and you make an adjustment to those few sections, you're affecting 2 joint areas instead of 1.
Yep.
Any chronic we could talk.
Yeah.
And then even with surgery, still have the ability. You could injure nerves
Right.
that may not have been injured the first time.
That's right.
So
One of my thoughts is maybe even the wrapping around bones is very sensitive, called the periosteum.
mhm.
And so one of my thoughts is, if you're going to fuse and they're going to drill in those things and you're going to break the periosteum, there is going to be pain. The reason why I think a lot of people have painkillers afterwards, obviously, even an epidural, which the side effects of an epidural can actually last up to 3 years.
Right.
So you may have numbness of an epidural for up to 3 years. Most typically it's around 6 months. Even those who have given birth and have an epidural, many women actually experience numbness in the legs for months and months afterwards.
Or even just pain
At
the site.
Yeah, pain at the site, exactly. And of course, the last one that we've talked a little bit about, if they're having neck surgery, you may actually have a failure to heal. And why is that?
Well, a lot of that's that communication we've talked about in videos before. Is especially up in that upper cervical area where that brain stem exits out the base of the skull, all that signals that say, hey, let's heal this properly, may not be the signal that it's getting.
Especially if you cut the nerve or something like that is happening, there is not a proper signal of saying heal this way, heal that way. And your brain is the controller of that. Your brain controls how you heal.
Right.
And if it's not connected properly to your tissues and your tissues aren't properly connected to your brain, those tissues do not heal.
Right.
And we know this. We know that because if you sever the spinal cord, if you sever nerves, whatever tissue, organ, muscles attached to the end of those nerves, they die.
They die.
Yeah, and they get there and they're cutting. Now they really do have to cut things out because we can't have dead tissues inside of living bodies.
Right.
Yeah.
So those are some of the side effects of surgery, and a lot of people do go that route, and sometimes 10% probably still need to have that surgery, but 90% can have.
Look for alternatives.
Look for alternatives.
Look for alternatives. Don't necessarily agree with, or even chiropractic isn't necessarily. I'm going to say get it checked,
Right.
Because rarely do we see a neck pain that we have to say no, we can't help. I mean,
Right.
I don't know if I have had one yet.
And I still even think, just if you want the cost benefit the route, a lot of times it's a lot cheaper to go see your chiropractor and get your neck taken care of. And you know what? If it doesn't get better, there's other routes that you can go to. And if we wasn't right, then okay, if this didn't fix it, now we're going to go to a more permanent route and have surgery.
Right.
But again, not everybody needs to have surgery.
That's right.
And I think sometimes I've even talked to people who've gone to have surgery and the doctor's like, let's hold off a little bit longer, see what we can do. And I think sometimes we as humans I want to be better right now. And of course that's just, we're not patient enough.
Yeah. Well, knowing how the body heals, and I'll be honest, Dr. Aaron, I was one of those people.
Right.
Yeah, give me the pill. When I injured my back, I asked my medical professional, I said, what about surgery? Let's do it. Just fix me.
Right.
Well, what I didn't get at that time was I heal better than them trying to fix me.
Right.
I'm not a robot. I'm not some sort of machine where you just pull a part in, put a part out. You know what I mean?
Oh, are you sure about that one?
I'm pretty sure.
Okay.
And thankfully, he deterred me from having surgery.
Right.
And then I started to discover all their alternative routes.
Right.
And it took me a while to figure it out. I mean, it did. But I'm glad I did, and I'm glad I went that route because now I get to live. so much more naturally.
Right. And I think a lot of it too, which you didn't really say, is that it took a while to heal, but you know, who knows, if you would have had that surgery, you could probably still be healing from it.
From the surgery itself and from the injury itself.
Right.
So
because you always have to heal from surgery.
And that's, of course, that's a little bit of speculation. We have
Right.
to say that. But at the same time, when we're dealing with pain specifically, you want to get all your natural available options off the table first before
Right.
seeking for a permanently solution.
Right.
Like sticking metal in your neck and stuff.
Right.
Well, there's other ways that we can have neck pain, isn't there?
Right.
Yeah, so especially nowadays, there's a specific, neon sign neck pain problem that's going on.
Right. Cell phones.
Cell phone and devices.
Devices. We leave you up to your own devices.
Right.
But it's interesting, you have that 10 to 12 pound bowling ball at the top of your head being supported. And that's if it's straight up and down, that's 10 to 12 pounds. And you just tilt your head 15 degrees, it doubles.
Yeah, so that's not much. So that's like me standing here being like this. That just doubled the strain in my neck.
And then if you go to 30
Or maybe
degrees.
30. I might be at 45, I don't know, 15. Maybe 30, somewhere around here, I don't know.
That's up to 4 times.
4 times the amount of strain.
The amount of strain on your
Wow,
neck.
that's a lot.
And if you imagine if you're at 60 degrees, you're at 60 pounds.
So 45-ish is somewhere around here, right? So
Yeah.
if I'm 60, that's like
Imagine if you go.
I'm watching your shoes here,
Yeah, when you go to 90, and it's not always that. You look down your phone and you look down for 2 seconds, you get a text message, you look down. I don't think those are the big things. It's that when
Right.
you're sitting there scrolling through Facebook for what you thought was 5 minutes, but it ended up being an hour.
Right. Well, and there's some things. So there's some tricks we can even here on our video that we can say, look, if you're gonna look down your cell phone, don't just drop your head down. You're
Right.
tuck it down, get that little bit of a tuck in there to look down. Bring it up to eye level.
I like to tell people bring it up to eye level, not iPhone level.
Right. Yeah, exactly. Bring it up to eye level. I like that. Not iPhone level. That's cute. So those, bring it up, tuck down if you got to look down a little more. And second of all, try to get the stretch in there. If you have been down there a long time, come back, take a little breather, let the muscles relax. Most people don't know that this does not curve your neck forward.
Right.
It's that standing up tall that actually creates that natural curve in the neck and bringing that nice tall frame. And so that get into that little bit of a stretch and let the neck, those muscles relax how they're supposed to and work how they're supposed to.
Yeah, I was just looking back between 2014 and 2015, the amount of times people looked at their phone increased a lot too. I have that number up. Let me scroll up just a little bit here.
Oh, I can imagine it's like 80 times or something.
In 2014, it was 13 times per day, and then in 2015, jumped up to 46 times per day.
Oh my heavens! That's 3 times as much.
And then looking even into further, if you break it down by age, I'm sure everybody can determine what the age group is who looks the most. It's those 18 to 24-year-olds look about 74 times a day.
How much? 74 you said?
74.
74 times a day.
Right.
They're checking their phones.
Compared to us older people at 35 to 44 years of age,
Yeah.
only look about 35 times a day.
Well, let me see if I can count it. So I got to be less than 40. Once when I got up,
Oh man.
then I guess after I used the washroom,
The bathroom.
went to the loo, used the water closet. Right before I left to come to office,
When you got here?
when I got here, I did.
And then when you got here? From the car to here?
No, it's just when I came. I didn't check it from the car to here. Probably about 5 times since, so maybe about 9-10 times in the morning. Wow, that's a lot. I'm almost at my 13. I gotta be careful. Yeah, it gets increased. But there's so much on that device now. With that, I think what we're saying is just be conscious about how you're using it. There is actually a nice neon sign out there now. It's text neck. There's a real term now for kids and people who are literally like this all day, pew 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 on their phones, and it's just so simple to just, hey, kids, can you just bring it up a little bit more, right? Parents, can you be a little more conscious about that? You know, if you're checking your phones and things. We're not saying you can't have a lazy minute or something, but hey, let's get that back up and sitting up a little easier and taller.
It's just amazing the amount of strain that you can reduce from your neck or add to your neck just by bending it ever so slightly.
So how can upper cervical help? I think that's the obvious answer, but how?
One, figure out what's causing the pain.
Right.
If it's what we've used the word subluxation a lot, you can check back in our other videos to find out what it is, or just type in subluxation. It'll give you.
Well, let's just say that's a joint locked out of its range of motion that's putting pressure on the nervous system somehow.
Right.
That's a rough definition.
Right.
Okay.
And so if that's decreasing the signal, the body's going to start functioning in different ways than it should before. Also, the other one's posture.
Right.
How you're carrying yourself.
Yeah.
We're really good at avoiding pain. And we find if it hurts to tilt your head or have it centered, but you tilt it off a little bit to the right. Yeah. What's your body going to do? It's going to adjust, and now, you're avoiding pain, but
the muscles are working 40, 50, 60 times harder.
Right. And I think another interesting one that I talk to people a lot of time too, is just go ahead and grab a pen for 3 minutes and just hold it there. Yeah. And then after that 3 minutes, go and open your hand and tell me if you don't have pain in your hand from those muscles, learning, okay, this is the way I'm going to be, and then you go and open them up, and that stretch receptors, it's going to be sore a little bit, but imagine you're down here at your phone and you're clicking away, and then all of a sudden you go to straighten up your neck, and all of a sudden you're going to have pain from that. So I think the obvious answer is if we're checking things, we're going to be able to check muscles, the joints, and even the nervous system. I mean, we said this, who in your life, you're getting your teeth checked twice a year, who in your life checks your brainstem and spinal cord? Right. Go see an upper cervical chiropractor, especially if you know someone who has neck pain. You're the person that has neck pain. Get them checked and see if there's some assistance there for you to get your body healing the way it should be. Remember that one of the side effects, not healing properly? Right. Well, we don't have to cut things to stop healing. We can just pinch them off. Only 70%? Yeah, 70% can decrease nerve function. No, weight of a dime. Weight of a dime can decrease nerve function by up to 70%. Right. And so if that little tissue there is just giving a little bit of an extra squish, or you're squishing your brainstem a little bit, you're going to get all sorts of crazy fun things going on. Right. And so find an upper cervical area. If you don't know of one, there are a couple websites you can check out. The upcspine.com website. Love the creators of that website. Thank you so much for putting that up. The Blair Chiropractic website. We are Blair Chiropractic professionals. So you can just go to blairchiropractic.com and locate a doctor if there's one in your area. Those two websites alone should get you close to somebody. If you can't find somebody from there, please give the office a call. Or if you're somebody who has neck pain, give the office a call. 435-688-0444 is our phone number to get a hold of us. Or you can find us at simplyhealthchiropractic.com. Yep. Or if you found our page, you can just click on Facebook right to our page too with all that information as well. That's right. And if you're looking to email instead, there's a contact form at the bottom of our simplyhealthchiropractic.com. All right. What are we talking about next week, Dr. Aaron? We wrote it down and I forget what it is. Well, it's not our secret yet. Right. We have a secret one coming up. Yep, that's coming up in a couple months. Yeah, and when we have Valentine's Day episode coming up. Right. Yeah, so stay tuned for that one. So I think next week we're going to say surprise what the topic is, but it's going to be good. You're going to want to tune in and see what that is. We're doing that at 12:15 on Fridays, Mountain Standard Time. Mountain Daylight Time, I think they call it. Yeah. MDT. So anyway, thank you so much for tuning in, and we hope if you liked anything in this video, just like the video, like our page. We really appreciate that.
Subscribe to our YouTube channel. Thank you so much for tuning in, and we hope to see you very soon.
Thank you. Have a wonderful day.